you are permanently robbing these children of ever having their own biological offspring. And that's huge. That's ideology, not science. Having discomfort with your body during puberty is entirely normal. Children who are transitioned essentially become medical patients for life. The reason transgender ideology has enjoyed prominence of place is because there's been censorship. My name is Dr. Michelle Cretella. I am the chair of the Adolescent Sexuality Committee of the American College of Pediatricians and its past executive director. I think the first thing that everyone needs to acknowledge is that normally timed puberty is not a disease. Normally timed puberty is a critical window of development. It's not associated with only secondary sex characteristics, like boys getting bigger muscles, broader shoulders, deeper voices, developing mature testicles and sperm, girls developing breasts and maturing toward periods. It's more than that. It's also sex hormones directing the development of the brain. Brains are wired differently, whether you're male or female. When it comes to puberty blockers, if puberty blockers are used to treat a disease, then they are restoring function. Example, when children go into puberty too early, let's say you have a boy or a girl going into puberty at age 5, that is going to cause significant physical and psychological negative effects and consequences. So, in the case of early puberty, precocious puberty, which is a disease, it is acceptable to offer and use puberty blockers to stall that early puberty from age 5 until age 8 in girls, age 9 in boys. That's the earliest normal timing of puberty. Instead, in the case of gender dysphoria, we're dealing with children who are physically normal. They are physically going through this critical time period of brain development, bone development, as well as sexual development. And if we block them with the blockers at this stage, we are permanently robbing them of normal bone density. That has been scientifically established that children treated for gender dysphoria with the puberty blockers, when they get to adulthood, they do not have normal adult bone mass. That means they are at risk of severe bone fractures early in life. In addition, because we're arresting their normal sexual development, girls never develop functional ovaries. They don't develop mature eggs, and the boys do not develop functional testes or mature sperm. So while on puberty blockers, they are typically also put on wrong sex hormones. Girls are put on the blockers plus testosterone. Boys are put on the blockers plus estrogen. That combination permanently sterilizes the children or teenagers. It's not reversible. And because they've been on the blockers, there are no eggs to freeze for like future artificial reproductive technologies. There's no sperm to freeze use in reproductive technology later. You are permanently robbing these children of ever having their own biological offspring. And that's huge.
You've talked about so many consequences that are lifelong, and children can start getting these puberty blockers and cross sex hormones without even being old enough to understand these consequences, and not even require to have anyone who's responsible for them advocate or consent to what they are given.
That is all true. It's quite frightening. Most states do require at least one parent to consent for their child, but what's critical to understand is that children as young as age 8 may be put on these blockers, and in some cases, some gender physicians put them on blockers and cross-sex hormones together at age 8. However, even if they're being put on these blockers and hormones at a later stage, we know that the judgment centers, I'm pointing to the frontal lobes here, the judgment centers of the brain for human beings is not fully mature until age 25. This is why we don't allow children to drive a car before training in age 16. We don't allow drinking until age 21. Children and teenagers, they do not have the adult capacity to evaluate long-term consequences. I don't know how many children and teenagers who think having babies isn't important to me. And then by the time they're 21 or mid 20s, yeah, you know what? I used to think I never wanted a kid of my own, and now they do, right? There are very few things in childhood and the adolescent years that are permanent in terms of wants and desires, right? Because it's an active stage of identity development. It's entirely normal to be like, oh my gosh, I'm breaking out in zits and my voice is changing. We know that most kids normally begin puberty between the ages, let's say 10 and 16, but there's a wide variation in that normalcy. There are some boys, for example, who continue to grow in height, musculature, and bone structure even through age 19. And there are some girls, once they start menstruating, can be done with puberty 2 years later. So there is a wide range of normal within that window. And having discomfort with your body during puberty is entirely normal. The goal should be really encourage and affirm our children, all of their strengths, their character, their good character, their good intentions. We can sympathize with their struggles and their emotional distress and assure them that we are going to be with you through this difficult time. And we are going to ensure that no permanent harm comes to you. We're not out to control you. We are out to journey with you, to leave no stone unturned, to maximize your health. We cannot rob our children of their capacity to have children in the future. I mean, sterilizing, we're really talking about eugenics. There's excellent science to indicate that gender dysphoria is not inborn, but it's more of a developmental process or developmental response, like a defense mechanism against underlying trauma, underlying mental illness, or in some cases, it's a response to just innocent life circumstances. As an example, in 2010, I had a little boy, he was 5. Between the ages of 3 and 5, he increasingly became interested in cross sex playing, and to the point where at 5, he was telling his parents, I'm a girl. Transgender ideology says there is only one response to a child of any age who says, I'm not my sex. And that response is you must socially and or medically transition them. That's ideology, not science. So in 2010, we did not have those ideological pressures. I referred the family to a family therapist. And in play therapy, over the course of several sessions, this little boy eventually, through play therapy, came out with grabbing a Barbie and a truck and, Mommy, Daddy, you don't love me when I'm a boy. What was going on in the family situation? These were not abusive parents. But when we'll just call him Bobby, when Bobby was 3 years old, his little sister with significant special needs was born. Little Bobby went from being king of the hill, so to speak, for 3 years of his life to taking second seat. And not every child in that situation would internalize it that way, but our psyches, our psychology, our subconscious is very individual. He interpreted mommy, daddy love girls more than boys. If I were a girl, they would love me more. Once that misconception was identified, right? It's not mental illness and it's not abuse, but it was a false narrative. And once that was uncovered with play therapy, well, now the therapist could work with the family as well as individually with little Bobby. And over a couple years, he was really confirmed in the fact that, yeah, mom and dad love us both, and I am a boy. There has to be a recognition that it is not normal for us to be alienated from our bodies. It's not normal for our children or teens to be alienated from our bodies. The suffering is real. The emotional distress is real. We need to come alongside families, children, and teens. We need to come alongside them in partnership and in truth to explore what's going on underneath. What is this new identity? What purpose is it serving? Because it is serving a purpose. And how can we truly um, heal this emotional distress?
That is a great example of how therapy can be helpful in helping these children and parents to understand the underlying issue behind this confusion of a child. Therapy can also go really wrong, and that's where we see the first step of that, of the idea of a child being confirmed. These are the people who guide them to puberty blockers, cross-sex hormones, and surgeries. So how can parents be sure that they are in the right hands, that they can trust their medical professional to make that judgment?
So I recommend three websites. The first one is called literally therapyfirst.org. Therapyfirst.org. These are psychologists, psychiatrists, and other mental health professionals who are dedicated to the type of counseling that I've described. Counseling that is true to biology, true to biological science. It is safe, effective, and legal. And I use the word legal because we are often accused, those of us who urge this cautious approach to trans identification in youth are often accused of promoting conversion therapy. Conversion therapy is banned in 28 states in America, and conversion therapy is focused solely on the gender identity or the sexual orientation that's being professed. That is not at all what we are talking about here. What we are talking about here are not active interventions to change anyone's identity from a top down approach. What we are talking about is affirming the child in biological truth, psychological truth, and exploring together with the child and family what factors have led to this new identity. What purpose is this new identity serving? There could be, as many of the teenagers, for example, are dealing with untreated depression, untreated social anxiety. Maybe they have baseline autism, baseline ADHD. These are either neurological conditions or mental illnesses that we have safe, effective, and proven talk therapies and interventions for. So the goal of therapy is to maximize the child and teenager's health, accompany them on this journey of exploring what is underneath this identity, maintaining family communication and support, and helping them come out the other side, hopefully embracing their biological identity as true. I can tell you from the members of therapyfirst.org, even in the case in which a college student still claims a trans identity, they report mental health benefits from the exploratory psychotherapy. Many of them are thankful because of this delay, they've emerged with their fertility intact. So it's truly a win win situation for all comers. The goal is we want to maximize the child's health, we want to maximize the family's health as well. Parents and the family, they are the strongest resource these children have. In addition, for some really excellent self-help resources, biologicalintegrity.org is a project of the American College of Pediatricians, and advocatesprotectingchildren.org. I also serve on their board of directors, and our primary focus is to produce videos as well as self-help printed resources for parents, children and youth mentors, as well as schools and churches. So please do check out the resource tabs.
In the next couple of years, we're expecting to see a few cases that are being brought up to the court, about 13 lawsuits against gender hospitals, American Academy of Pediatricians, and others that are trusted institutions but have had these lawsuits against. So we should be seeing more of these records become public. what do you expect from that?
Correct. There are over 13 lawsuits that have been filed in the last couple of years by detransitioners. They are predominantly young women now in their mid to late 20s, and they were transitioned as teenagers. And these lawsuits have been filed against several children's hospitals, healthcare conglomerates, including Kaiser Permanente. As you said, the American Academy of Pediatrics has been named, and also Planned Parenthood. What's crucial is that their testimony, these cases will be argued before juries, and the testimony is going to be public record. Both actual harms that they incurred from the blockers and the cross sex hormones, as well as potential harms, will be public record. And the mainstream media, the mainstream medicine, and big pharma will not be able so easily to suppress it. The reason transgender ideology has enjoyed prominence of place is because there's been censorship from the highest positions in big pharma, medical education, medical journals, and our previous government administration prevented scientific facts from being released. As an example, whereas permanent sterility is certainly the most egregious and frightening permanent harm, children who are transitioned essentially become medical patients for life. They need to remain on cross sex or technically wrong sex hormones for life. And if you're female, that means you're on overdosed on testosterone for life, which puts you at risk for heart attacks, strokes, obesity, high blood pressure, sugar dysregulation, so like a pre-diabetes state, and cancers. I mean, a multitude of chronic illnesses. And similarly, if you're male, you're forced to be on estrogen, supraphysiologic doses of estrogen for the rest of your life. The bad effects of estrogen are like the bad effects of testosterone in women: heart attacks, strokes, cancers, prediabetes, a host of serious chronic illnesses. And we know from the studies of adults who undergo the medical transition with or without surgery, they they die at extremely younger ages compared to the general population. And even after transition, the suicide rate, and this was a 30-year study out of Sweden. So Sweden is hugely pro LGBT, yet over that 30-year study, the adults, both male and female, who underwent transition surgery and hormones had a completed suicide rate 19 times greater than the general population. We do not want to do this to our children. Eugenics is not the answer to the emotional distress of children and adolescents who identify as trans. We have to help them through with safe, effective, and legal psychotherapies that are going to affirm them as whole human beings.